Good afternoon, Robert. Thank you so much for joining me today for a conversation around COVID and the impact it's having on people around the world. Can I just ask you to start by introducing yourself? Tell us what you do for a job and where you are in the world today.
Yeah, so I am Professor of Health Psychology at University College London. I head up a team of researchers looking mainly at smoking, but also at alcohol. And I'm Editor-in-Chief of the journal Addiction, so try to keep a watching brief on the broader addiction front. And in addition to that, and actually I think increasingly importantly these days, I'm working with a colleague, Susan Mickey, colleague and wife as it happens, Susan Mickey, on a thing called the Human Behaviour Change Project, which is a very ambitious program to try to use artificial intelligence and machine learning to help us to synthesize evidence on behaviour change more generally.
Fascinating. And you're talking to us from London today.
I am. I'm talking from North London, Kentish Town, next to Hampstead Heath on a glorious sunny day.
Wonderful. So it's May the 5th, 2020. The UK's been in lockdown for about 6 weeks. I guess I'd like to ask, first of all, what's been the impact of COVID-19 on people's smoking behaviour?
It's early days, but a survey just out, which was commissioned by Action on Smoking and Health in the UK, has shown that around 500,000, just over 500,000 smokers report that they've tried to stop smoking as a result of COVID, and around 300,000 say that they have stopped as a result of COVID. Now, obviously, this is short term, and we know from past experience that many of those will relapse. But those figures are really quite substantial, and if this is real, in the sense that you take away social desirability bias and so on, what you're looking at is probably quite a large net decrease in smoking prevalence. Time will tell. I would like to say that our own research, where we've been surveying people every month for the last 10 years, would support that. Unfortunately, our March survey had to be pulled right in the middle of it because of the lockdown and not being able to do face-to-face contact. But we've resumed it for April and going forward. So we will get a pretty good idea in the months to come as to how big the reduction in smoking has actually been.
That 500,000 figure you give, what proportion of current UK smokers does 500,000 people represent roughly, do you think?
Well, I'm going to do some mental arithmetic to answer that question. So smoking prevalence in the UK is around 15%, and the adult population is around 50-something million. So there's around 7 million, roughly, if I've got it right, around 7 million smokers at the moment. So 500,000, it's not an insignificant figure, about 1 in 14. So about 7%, something like that.
I'm so pleased you did that math. I was scribbling away. But, yeah. So, and that's obviously a very positive thing. Do you have any idea whether those people have then sought some sort of nicotine replacement, or have they switched to vaping devices, or have they just quit?
Early days, actually. Evidence so far suggests that the proportion who are using some kind of support has been quite similar to what it was before in terms of using licensed nicotine products or vaping devices and so on. As your viewers will probably be aware, e-cigarettes are the most popular aid and have been for some time now in the UK. So that will be the single most important. Unfortunately, when it comes to things like the stop smoking services, of course, we can't have face-to-face contact, but some of the services have moved to online or telephone support. It's a bit early to see what impact that will have had, but it's actually still a very, very small proportion of smokers.
Okay. Is there any reason for us to be concerned for people switching from smoking cigarettes to vaping? Is there anything that, because obviously earlier on in the year we were hearing about outbreaks of vaping death, in Canada and America, and vaping liquids. Vaping's safe if you are worried about COVID?
Yes, as far as we can tell, I mean, all that stuff earlier in the year about vaping deaths was really vaping for THC and adulterated, as far as we can tell, THC adulterated with vitamin E acetate. And we didn't see anything like that in the UK. I mean, just nothing at all. So vaping regulated e-cigarette products is, as it always has been, much safer than smoking, and as far as we can tell, carries no acute health risks. So any risks from vaping will be long-term ones, and they will be obviously a very small fraction of what you get from cigarette smoking. So I don't think there's any particular concern there. When it comes to a particular risk from vaping in terms of COVID, then I think we obviously don't know, but working from first principles, I would expect that if there is a risk, again, it would be similarly substantially less than from smoking.
And there isn't any worry about droplet transmission when you're vaping and exhaling smoke if you had COVID?
Not as far as we can tell. There's no. I mean, the vapor is not. It's not that kind of vapor, and obviously cigarette smoke is particulates and so on. So there's no particular reason to imagine that it would pose a particular risk. Having said that, it's also worth bearing in mind that it remains the case that both smoking and vaping are not generally permitted indoors, and if you're outdoors, then smoke as well as vapor dissipates very quickly, so it's unlikely to present a risk.
Excellent. I kind of asked that question because I know some people watching may still have a hangover belief that vaping in some way is risky and that they should carry on smoking, but that's been dismissed.
Yeah, I think just to reinforce that, the idea, carry on smoking instead of switching to vaping is not a rational thought.
Right, we're clear on that. So I guess the other bit I'm interested in is there's some reports that came out, I think originally based on some epidemiological data out of China, is that somehow nicotine might be protective against COVID. What's the possibility of nicotine protecting against COVID and smoking protecting you against COVID?
Yes, this was an observation that was made originally in China and then subsequently in some other studies. And what it arises from is the observation that the proportion of smokers in hospitalized cases, or put it this way, the proportion of people recorded as being smokers in hospitalized COVID cases in China was substantially lower than the prevalence in the population. And so you think, well, okay, that makes a prima facie case that maybe smoking might be protective. And then people start to think about what kind of mechanisms there might be. However, there is a real problem with using those data, and that is that the recording of smoking is likely to be suppressed in situations like that for two reasons. One is that people might not always be honest. Another is that in any clinical situation, in the best of circumstances, recording smoking status is difficult and often not done, and therefore you get a false low rate of recorded smoking. But another factor is that by the time you get into hospital, you will have probably had some symptoms for a while, and there's a reasonable chance that if you were smoking at one point, you would have stopped before you get into the hospital. So you have to then look at other sources of data to see what the situation is. And what those data are showing is that actually, if anything, smoking probably increases your risk of hospitalization. And if you are in hospital, it increases your risk of having pneumonia. and going on to have to be ventilated and going to ITU. So it's still early days. I don't think we know the situation now, but my reading of the data at the moment is that far from being protective, smoking is a significant risk factor for, if not getting the infection, then certainly suffering more severe consequences if you do get it. And of course, that wouldn't be surprising, because smoking confers on you all of these serious underlying conditions that we know put you at risk of more severe disease. Then if I can just expand on the mechanism a little bit, following those early reports, then Pierre Changeux, who is a highly respected, eminent neuroscientist in France, postulated a mechanism by which nicotine might be protective. And it was really to do with the fact that the the SARS-CoV-2 virus, which causes COVID, it mainly gets into the body through the ACE2 receptor, and that there are strong interactions between nicotine and those receptors and other receptors. And he also postulated that the nicotinic acetylcholine receptor was also some way involved in the renin-angiotensin system, for those people who are interested in the technicalities. So he put forward this hypothesis, which led in France to a massive run on in the shops and so on and online on nicotine products, nicotine replacement products. So much so that in France they've had to ban the sale of these products, except in limited quantities through pharmacies. So this is a very salutary lesson to us. So even when you put hypotheses out there, that if the public are listening, then they will take action ahead of any particular evidence that these are genuine.
Particularly when given by someone who is an eminent scientist, as opposed to Donald Trump, where clearly some people still paid attention to what he said. How come that the very clear message you've just given, which is quitting smoking is always a sensible thing to do, but it's probably even more sensible now than ever, why don't you think that message has kind of got out there as much as the nicotine might be protective message?
I wish I knew the answer to that. I've got a hypothesis, put it this way, and it's the dog bites man, man bites dog hypothesis, which is that smoking exacerbates risk of a respiratory virus, not news. Smoking protects against risk of a respiratory virus. Wow, that's interesting. So the salience is probably a big factor there.
Right, that's a lesson for us all when working with the media, is if you've got several stories to tell, make sure you find one that is both a public health relevance, but is also going to sell copy. And
there you go.
Sometimes the two don't meet. Robert, the final thing I would like to ask you is that in some countries, life may gradually be returning a little bit to normal. People may think lockdown is lifted, we can return to our life as normal. Now, in your role as a senior government advisor, you've obviously been thinking a lot about the things that people need to continue to do when they return to the outside world. Can you tell people about the changes they need to hang on to?
Well, the first thing I have to say is that in my role as a government advisor, one of the things I must do is say that any advice that I give in public is in a personal capacity and not speaking in that capacity. So speaking in a personal capacity, I think that there's a couple of things we need to remember about this. And that is that in most countries, the prevalence of the disease, or the proportion of people, let's say, who've had the disease remains below 10%, probably, right? That means 90% of the population could still get it. They haven't got it yet. And so all of these deaths and all this terrible suffering and so on we're seeing is from a prevalence of around 10%. What that means is that as we start to ease the statutory restrictions and start to get life back to normal, which we have to do because the world has to restart its economy. People's suffering is already being massively caused by the contraction in the economy and so on and so far. So we have to get back to normal. So as this happens, we as members of the public are going to have to be extra vigilant in the things that we can do to protect ourselves and the people around us. And these are well known, and they've always been known, but they have tended to get less emphasis than the big measures, the big epidemiological measures, the quarantines, the isolations, and so on. And they're based on this very simple principle. Infection occurs because the droplets come out of a person's nose or mouth, for whatever reason, coughing, sneezing, or speaking perhaps, into another person's body. And there's only 3 possible routes into the body from the virus, from these droplets. One is through the nose, the other is through the mouth, and the other is through the eyes. That's it. It doesn't come in through the skin. So personal protective behaviors are needed to minimize the expulsion and of those droplets from the person who may be carrying the disease, and to minimize the ingress of these droplets and the virus through this, what we call the T-zone, presumably because it's like that. It's the eyes, the nose, and the mouth. So first thing is absolutely critical is never, ever, ever to be coughing or sneezing into the air, right? And not into a hand. I know this, people have said this before, and I can't stress how important it is, because the thing about the hand is you've coughed into the hand and now you touch a surface and you create what's known as fomites. Fomites are contaminated objects and surfaces. The virus lives on those surfaces for potentially up to several days, right? So you've got the direct route of transmission. So don't cough or sneeze into your hands. You cough into a tissue which you then dispose of. The second thing, of course, is maintaining a physical distance. There are situations where you can't do that, but if you can keep 2 meters away from people, then it's okay if you're just passing them in the street. There's actually very little transmission outside in the open. It's mainly in enclosed spaces. So if you keep that distance, then that will help to limit the direct transmission. But you've also got, very, very importantly, hand washing and hand sanitizing with an alcohol-based sanitizer with at least 60%, hopefully more, alcohol in it. Anything less than 60% won't work, but soap is perfectly good as well. So washing your hands all the time. And then finally, really, not touching your T-zone unless you have just washed your hands, because you really don't know where your hands have been. And as I say, the virus lives on surfaces for an awful long time. So if you can, whatever you can do to avoid touching your eyes, nose, or mouth until you have washed your hands is going to be critical. These kinds of what we call personal protective behaviors, they are the sort of micro routes, the sort of the micro behaviors that will keep us safe. When, as will inevitably happen, we go into situations where there is potential contamination.
I mean, that's a beautifully succinct message for people to walk away with, but also the incredible emphasis on personal responsibility, not relying on equipment, but relying on behaviors that we can all, every single day, adapt and integrate into our lives. And I wonder if that's a good thing, because it's really empowering for people. But I can also imagine at some level, quarantine's a bit like, it's not my responsibility, like I'm being protected by government regulation as things return to the individual's responsibility. I can imagine that.
As we do that, then I think what will happen, I hope what will happen, is these behaviors will just simply become norms. They'll just simply become normative. It'll be like, if you're out and about, or in a meeting, and you see someone sort of doing this, with it, then it would be as weird to see as someone sort of taking down their trousers. You think, what are they doing? This is nuts. So that's the kind of thing which means that it's still obviously within our personal responsibility, but it's just become normal. It's like we're not going to be moving back to handshaking anytime soon. That's just really not going to happen. And it's a shame in a way, but there's other things that we can do to show respect. We can go namaste. So yes, I think it should be empowering. People should be willing to take responsibility, and the vast majority of people are. But in addition to that, around it all will be these norms, hopefully, which will mean that actually it's not even something you have to think about.
I look forward to all of us adopting those things without thinking. And I for one yes. I'm a slow learner, but I will feel reinvigorated after this video talk. Robert, thank you so much for sharing your expertise and dispelling some of the nonsense myths out there, but reminding us how important it is just to stop smoking at any time.
Absolutely. And if I may say one last thing then in relation to that is that in the UK, for example, we think that the COVID has killed probably at this point maybe around 40,000 people. Smoking will kill more than 70,000 people this year. So, we just have to remember that there's a lot of other risks out there, and smoking is a very, very big one.
Thank you. Take care, Robert.
Cheers.
Just taking it one day at a time. Still don't know what I'm trying to find. Really I don't mind, cause I'll be fine. Yeah, I'll be fine. Yeah, no longer focused on yesterday, and I don't care, the rest will say whatever they want. What's left to say? What's left to say?